Welcome to Mini Medical Lessons. Today, we're unpacking a critical public health issue affecting millions globally: hypertension, also known as high blood pressure. This video will give you a comprehensive understanding, from the causes and complications to lifestyle modifications and the latest in medical treatments. Hypertension affects more than 1.13 billion people worldwide. According to the World Health Organization, it is responsible for approximately 7.5 million deaths each year, accounting for about 12.8% of all global deaths. These staggering numbers highlight the importance of awareness and effective management of this condition. Hypertension is not just a problem for older adults. It's increasingly being diagnosed in younger populations, including children and adolescents. A sedentary lifestyle, poor diet, and increasing stress levels are significant contributing factors. Understanding the scale of the issue can help us take proactive steps toward prevention and control. According to the ESC/ESH 2023 guidelines, blood pressure is considered elevated when systolic BP is above 130 millimeters of mercury, or diastolic BP is above 80 millimeters of mercury. There are two main types: primary essential hypertension, which has no identifiable cause and accounts for over 90% of cases, and secondary hypertension, which results from identifiable underlying conditions. Blood pressure is the force exerted by circulating blood on the walls of blood vessels. Systolic pressure measures the force during a heartbeat, while diastolic pressure reflects pressure between beats. Maintaining optimal pressure ensures adequate perfusion without damaging arteries. Overactivation of the sympathetic nervous system. Dysregulation of the complex renin-angiotensin-aldosterone system, RAAS. Endothelial, vessel cell lining, dysfunction and decreased nitric oxide production. Increased sodium retention leading to volume expansion. Structural vascular remodeling. Secondary hypertension mechanisms depend on the underlying condition. For example, renal artery stenosis, which reduces kidney perfusion, triggering RAS overactivation. Primary hyperaldosteronism leading to excessive aldosterone secretion, causing sodium and water retention. Pheochromocytoma causing episodic release of catecholamines, inducing vasoconstriction and tachycardia. Cushing's syndrome increases cortisol, enhancing RAS and insulin resistance. Coarctation of the aorta, which increases upper body vascular resistance, because it may cause no symptoms until it's advanced. Some people may experience headaches, dizziness, nosebleeds, or visual disturbances, but these are common conditions too. Many discover it during routine checkups. Long-standing uncontrolled hypertension can damage organs: heart, left ventricular hypertrophy, heart failure, ischemic heart disease, brain stroke, transient ischemic attacks, vascular dementia, kidneys, nephrosclerosis, chronic kidney disease, eyes, hypertensive retinopathy, peripheral arteries, aneurysms, claudication. Diagnosis requires multiple elevated blood pressure readings on different occasions. Use of ambulatory or home blood pressure monitoring improves accuracy, since random doctor office readings can be affected by multiple factors. Workup includes checking renal function, electrolytes, ECG, urinalysis, and screening for secondary causes in younger or resistant cases. The modified DASH, or dietary approaches to stop hypertension, diet prioritizes very low salt intake. Replace salt with pepper, herbs, garlic, and spices. A high intake of fruits, vegetables, and whole grains is recommended. Also, aim for a moderate intake of lean meats, nuts, and seeds. It's important to avoid processed food, excess alcohol, and sugary energy drinks. Regular physical activity, weight reduction, smoking cessation, and stress management are crucial. HIIT, or high-intensity interval training, is both convenient and productive. When lifestyle changes aren't enough, medications help control blood pressure. The main types of medicines include thiazide diuretics, for example, indapamide, which promotes salt and water excretion. ACE inhibitors, such as enalapril, block the RAS and vasodilate. ARBs, like losartan, are similar to ACE inhibitors, but with fewer side effects. Calcium channel blockers, for instance, amlodipine, help relax vascular smooth muscle. Beta blockers, such as atenolol, slow heart rate and cardiac output, though these are not first-line medicines unless there are important comorbidities. For example, surgery for pheochromocytoma or coarctation. Aldosterone antagonists like spironolactone are used in hyperaldosteronism. Tailoring treatment to age, comorbidities, and side effect profiles is essential. Without control, the outlook is significantly worse. Blood pressure control significantly reduces the risk of stroke, heart attack, and kidney failure. Regular checkups, adherence to therapy, and ongoing lifestyle management are key to long-term health. To recap, hypertension is common but controllable. Understand the causes, get screened regularly, and follow a comprehensive plan involving lifestyle, and, if it persists, consider medical management. Like, share, and subscribe if you found this helpful, and check out our Instagram for bite-sized carousels and reels on this and more health topics. Ditch salt, pinch pepper, maybe add meds. Mini Medical Lessons. Subscribe button follow at Mini Medical Lessons on Instagram.